guys, it's Jason from BodyWorx Physio, here today to talk to you about rotator cuff injuries and rotator cuff pain syndromes. So the rotator cuff is 4 muscles in the shoulder: your supraspinatus, infraspinatus, teres minor, and subscapularis. So if this is the shoulder joint and this is the arm bone or the humerus, they basically come in and attach onto that bone and make sure that as it moves, it holds the right position as you're using your arm doing activities and sport. So a number of issues can happen with the rotator cuff. We can get bursitis. So a bursa is a small fluid-filled sac that sits in the top of that joint and protects the tendons as it's moving, or you can get small tears in the rotator cuff. In both of these conditions, we start you off with a graduated strengthening program. So number one, we want to settle down the pain and inflammation in that joint. Now that can be done with a mixture of treatments including anti-inflammatories, icing, supportive tape, dry needling, ultrasound, massage, and a few other smaller things that physios can also do. So that's stage number one, where we want to settle down that pain and inflammation. Stage number two, we want to try and get it moving better with some stretching and strengthening exercises. So stage one is stretching, so we'll do things like pec stretches, so putting your arm in a doorway and turning away. If that hurts, we'll usually start you down lower so that it doesn't hurt as much when you're going through there, and gradually work it up through that range as your shoulder recovers and you're able to get better range. Our next stretch we would do is using a foam roller. So foam rollers are great to increase your thoracic extension. Now we want to increase thoracic extension so that as we lift our arms up, it gives us better range. If we're down like this and we try and lift our arm up, the joint's going to hit together much earlier in that. So to do this exercise, like in our other videos, we're going to place the foam roller on the ground and arch over it. If that hurts your shoulder to start with, we can put our arms across the chest and do it from that position. To take that a step down, if that's too aggressive, you can start with a rolled up towel and just gently arching over a rolled up towel. The next stretch that we do is for your posterior cuff, so the back part of your shoulder. So to do this, we lay on our side with our arm up and then we gently take that arm down. Now when we're doing this stretch, we want to feel it at the back part of our shoulder, not in at the front part, and we don't want a sharp pain there. If you're feeling a sharp pain at the front, try gently rolling your chest backwards, and if you're not feeling enough of a stretch, gently roll it forwards as you do push that arm gently down that way, and that will increase the stretch you feel at the back of your shoulder. So level 1 is settling down the pain and inflammation. Level 2, getting it moving with some stretches.